Hello again, this is Dr. Carlos Altamirano. I'm a bariatric surgeon working in Tijuana, Mexico. And today we're going to talk about the gastric bypass. Like I said, the more we change the GI, the more aggressive the surgery is. And in this case, the bypass, it's a more aggressive surgery. You're going to need some nutritional support, about vitamins and calcium. We're going to talk about nutrition later, but first you need to understand the procedure itself. Again, we have a normal GI here, and we're going to do a little pouch, a gastric pouch. We're going to do this cutting. We need to dissect the esophagus and everything. Sometimes you can have a hiatal hernia. We need to fix it first, and then we're going to do this. Well, it's not mandatory actually in a bypass to fix the hiatal hernia, because if you have reflux, the bypass itself is an anti-reflux surgery, so we can only do the pouch, and then we separate this is the gastric pouch. So we go down to the intestine, and we normally take 2.5 to 3 meters of intestine. I think it's like 6 feet or something like that. Then we are gonna do something called an anastomosis, or we're gonna stitch the intestine to the gastric pouch, and then intestine with intestine. So there are two anastomoses. This is a roux-en-y bypass. There are other bypasses like the single anastomosis bypass. Okay, this is a regular, more traditional bypass, the roux-en-y. So we made these connections between the intestine and the stomach, the intestine with intestine, and this is how it works. The food is coming down to this way. We call this limb the roux limb. There is no absorption there because or digestion, because you don't have gastric juices, pancreatic juices, or bile. So actually this roux limb doesn't have absorption or digestion, and the digestion is going to happen in the common limb. So that's after the intestine is connected with intestine again, so the juices are going to be here, and you can see that the juices is coming down to the bile limb, and the common limb is gonna make the digestion actually. Okay, I told you that the more you change the GI, the more aggressive, so you're gonna need more vitamins. What's gonna happen here is that you have malabsorption, and well, you can tell. This is passing right away. There is no regulation, there is no sphincter or valve to control the passing of food. So it's passing really fast, and sometimes the sugar or the osmosis of the food can produce a really aggressive response to glucose, for example. So you're going to have a really high peak of insulin, but that's not the real problem. The problem is that when you do this metabolic surgery, you're going to be much more sensitive to insulin. We have talked about insulin resistance, we have talked about incretin effect. So remember, you're not just improving the response of insulin, so you're secreting faster and better insulin, but you're actually more sensitive to insulin. So you're going to have a high peak of insulin that is more effective than before, and you can have something called dumping syndrome. So you're going to feel shaky, you're going to be sweaty, you're going to feel sleepy, dizzy, and you can even pass out, because your response to glucose is so good and it improves so much that you need reprogram your body to have responses that are less aggressive. And that's why this is much better for diabetic patients, and is as good as the sleeve gastrectomy for weight loss. So if you're just looking for weight loss, you can choose between both. They are both as good, but the bypass is more aggressive for pre-bad diabetic patients. This is a more aggressive surgery. You can have more complications like gallstone and kidney stones and vitamin deficiencies, and you're going to need a nutritional support for that. And we're going to talk about the duodenal switch that is even more aggressive, and that's why you need to understand which procedure is better for you. If you're just looking for weight loss, the sleeve gastrectomy is as good as the bypass. And remember that these are tools. You need to change your lifestyle, you need to do exercise and diet to keep your weight away. And see you next time. Bye bye.